4, 3, 2, me, 1.
Hi, we're here today with Lucy Postolov, licensed acupuncturist and herbologist, and we're going to be discussing her specialty of herbology. Hello, Lucy.
Hello.
Lucy, tell me, what's the difference between Western medication and Chinese herbal medicine?
The difference is huge. As you know, my background is in Western medicine, and when I studied Western medicine, pharmacology probably was one of the most complicated subjects. However, when I went to Chinese medical school and studied Chinese herbology, it was even worse because there are 4,000 different herbs. And each of them have a different temperature, different taste, goes to different channel, meridian, has different indication, contraindication, and on the top of it, all these 4,000 Chinese herbs can interact. So it is an art and science in the same time. And a lot of Western drugs are derived from Chinese herbs. For example, a lot of inhalers which people use for asthma come from Herba ephedra, or aspirin comes from the bark of the tree. So in Western pharmacology, we are using synthetic drugs and also the extracts from the herb. In Chinese medicine, we're using only natural herbs.
Lucy, what is Chinese herbal medicine good for?
Chinese medicine is good for mostly chronic conditions. If somebody has, let's say, acute heart attack, appendicitis, I would never say that Chinese herbs would be appropriate. However, if somebody have chronic headaches, hormonal problems, chronic low back pain, fatigue, infertility, they're battling cancer, then when Chinese herbs will be appropriate. And the most important thing, I think, is prevention and treatment of symptoms of cold and flu, because as of now in Western medicine we don't have anything which helps with symptoms. We have something that helps with symptoms, but not prevention, not the treatment of cold and flu.
Is it safe for pregnant women to take Chinese herbs?
It is a very controversial question. Some acupuncturists will prescribe Chinese herbs for pregnant women. I'm coming from a very conservative background. I do not use herbs for pregnant women. However, for infertility, I will use Chinese herbs very often.
How long should I expect to be taking this Chinese herbs?
Well, it really depends. We have so many different companies, so many different indications, and it's a difficult question to answer, really. For example, this Formula Mobility 3 will be used for acute low back pain, while if somebody have a chronic, it will be a different formula. For women with premenstrual tension, it's going to be usually a month or two to regulate her hormonal cycle. For patients with diabetes, with blood pressure, sometimes we need to use herbs for half a year. So it depends on the modality and condition. It will vary.
Lucy, thank you very much for your time.
Thank you.